Gauteng Health Department has confirmed the arrest of a woman who was posing as a doctor at Thembisa Hospital. She was caught on Tuesday night and is expected to appear in court soon. An investigation by the hospital management and police is also underway to establish how she gained access to the facility. Now, this is not the first time the department has had to deal with fake medical practitioners. In February, another woman posing as a doctor was arrested at Chris Hani Baragwanath while trying to solicit a bribe from a patient. And of course, last year, so-called Tik Tok doctor Lani was arrested at Helen Joseph Hospital after bypassing security. All right, for more on the story, let's bring in the Gauteng Health Department spokesperson, Motalatale Modiba. It's great to talk to you. Thanks very much for coming on. I'm so incredibly confused about how someone can pose as a doctor. How did this happen, to your knowledge? Well, the latest case, that is.
Well, Michelle, as we've previously obviously from the public healthcare system is that we have easy movement in our hospitals. I mean, from an entry point at security level, you could come in pretending to be someone who's coming to see a relative or even someone who needs help. Obviously, once you are inside, and then you change, obviously, and that's why most of the time people will come in and then we only obviously catch them out once they're inside trying to do whatever that they're trying to do. The good thing is that at the moment, even with this challenge that we're facing, the system is able to pick up these people. Hence, you made reference to cases where we have been able to apprehend people and hand them over to the police. And similarly, even with this particular case, when the healthcare professionals interacted with this person when they were trying to do rounds to one of the alternative building structure ward, it became quite clear that their knowledge was very suspect, and that's what raised an alarm. And employees there were able to then alert security to say, we seem to have someone here who we're not sure, we don't think it's one of us because their story does not make sense when we're engaging with them. And indeed, when security came and the person was asked to produce their health professions Council of SA registration number, they could not, personal number, they could not, because remember that I could very well fake, let's say, an access card that seemed to look like the genuine thing. And then that then allows me to go in, move without being questioned. But once you start interacting with people who work in that space, you will be caught out because as it became clear, the person could not produce those things. And obviously, the police had to then be called in. The person was then handed over to the police and they spent the night, Tuesday night, in police custody. I think they're still in police custody at the Rabasoto police station, where we understand that they were expected to appear before the Thembisa Magistrates Court sometime today. I'm not sure yet whether they've appeared already before the courts, because one is yet to get an update onto that. But the way we will to get caught, simply because obviously once you are in a ward, you at some point, one way or the other, you'll start interacting with people there, and people know each other in terms of colleagues that work within the same space. Right, but of course, it is an area that we're concerned on, given that we have been working on measures to strengthen our security. You would know that we just now appointed new security companies for the next 3 years. So we're looking at other measures as well. We've been working on issue around CCTV cameras as well in strategic areas in a way that is not going to intrude on the patient's, what you call privacy. So there's quite a number of things that we're working on just to try and improve on this area.
So let me ask you this. You say that, it's obviously not the first time this has happened, an incident of a fake doctor at a Gauteng hospital. You're saying that they have, however, been apprehended, but it is worrying, isn't it, that every so often a story of a fake doctor surfaces. I'm asking the question tongue-in-cheek, but it's actually an incredibly serious matter. Obviously it is. Especially if this person goes ahead and treats a patient. Do you know in this case whether a patient was treated, number one, by this fake doctor, this person posing as a doctor? and also for how long they were able to carry on with this charade posing as a doctor?
What we know at the moment, and the matter obviously is something that is being investigated by the facility and then also by the police, but what we have been able to establish that obviously they did gain access to one of the ABT wards, and then I think they
What is an
had some
ABT ward? Sorry?
Oh, it's an alternative building technology. Remember, some while back during COVID-19, we expanded some of our facilities where we built new infrastructure.
Right.
So in Thembisa, there's an alternative building technology structure, which is basically it's a long term of saying it's not your normal brick and mortar. It's utilizing new ways of building to construct a structure. So we've got such kind of what's called an ABT ward. So that's where this person actually was moving, and they seem to have had some interaction with patients, and that's what we were trying to establish as to what extent and what does this mean in terms of the interaction that they would have had with patients that were in some of the patients that would have been in that particular ward. Of course, like you said, it's something that from our side it would be concerning, but at the same time, the very fact that you get to know about them as the media simply because we are reporting on this, it also shows the other side that there is a heightened level of vigilance, and also we are more transparent about this. I mean, this very same incident that we're talking about, you wouldn't, we would not be discussing this had it not been that we came out and reported, and we're reporting so that we can create heightened awareness, so that the public is aware that there would be chances, and therefore they need to be more alert and more vigilant, but also to ask that we work cooperatively. As you've said, in the Baragwanath situation, it was a member of the public who alerted us to say, there's someone here who wants to solicit some monies from me, claiming that they can assist me. So now it's that kind of cooperation that can help us to ensure that we stem out this kind of practices. And I think it's important that obviously from a law enforcement point of view, a strong message is sent out that those that embark on this kind of activities that has the potential to place the lives of patients and our own staff members at risk, the law will obviously be harsh on them. And that's why we've handed them over to the police, and we hope that they would be processed accordingly in line with the applicable laws. But it's something that we need to continuously raise awareness about, both within our facilities and also with the public, more so in our facilities in terms of strengthening some of the access control measures, ensuring that all our healthcare workers, when they are at the place of work, they're always having their identification tags and so forth. But we know that even when you have got your identification tag, someone can easily pick up a lost identification tag or even impersonate by faking. So it means it's not one measure that is needed, it's maybe multiple measures, but the most important is being vigilant and being able to send a strong message that to discourage others from even trying to go this route.
So you haven't answered the question about how long this person was able to carry on with this charade.
The person was apprehended around 8:30 in the evening, and from what we've been able to establish, it looks like they would have gotten access to the facility during the patient visiting hours. And obviously, probably they did not go when other patients went out, and maybe they I don't know, they lingered around within the facility, because many of our facilities, obviously, they are huge sort of facilities. And that's part of what perhaps the investigation will also assist us to close that gap, to say from the time when they entered as someone who's coming to visit during patient hours, and to the time in the evening when they did the rounds, where were they, what would have happened there, and so forth. So those are still gaps that we're hoping that the investigation and the report from the facility will assist us in closing that gap, because that will also help us in looking at gaps from the current protocols that exist within the facility. So that we can then see how to close that.
It's an interesting thing that, it's an important thing to verify that the doctors who are on service at any given time are legitimate doctors, right? But I understand that there's also the trauma part of a hospital. There's emergency. Doctors are very busy. It's often quite a chaotic situation at the busier times of the day and night. So it's difficult, I suppose, to, at every single corner, ask a doctor to verify their identity. How do we get around that? And of course, if a doctor does lose their identity tag, that needs to be reported immediately, and you know, security measures need to be taken to that end.
Yes. No, look, I think, Michelle, part of the reflections that we've obviously had from these incidents, it's certain areas that would require us strengthening. Some of the areas are short-term, some of the areas would be long-term. For example, the issue around CCTV cameras, we've started with that. It's a long-term thing. We've already addressed the issue of security and having a more fixed-term security on site. We've dealt with that. So we are progressively dealing with the different issues. And even the point that you are raising is also quite significant in that the whatever access control measures that we put in place when we are refining the system need to be such that, yes, they guarantee the issue of security for both patients and our staff members, but at the very same time, they also don't prohibit free movement within healthcare facilities. As you have rightly said, that you could imagine the nightmare where you go to our accident emergency, because it's not like in the private healthcare system where our accident emergencies, usually they deal with large volumes of people, and you don't want a situation where patient care is now also sort of delayed because you've got other processes that are cumbersome. So you need to find, our challenge now will obviously be to find a system that allows for a balance in terms of tightening the security controls, but at the same time, still allowing that flexibility in terms of not inhibiting the healthcare workers from discharging their duties insofar as the care that needs to be given to patients is concerned. And I think those are some of the things that the team, as it works on improving our protocols and our systems, will obviously have to look more in detail around that. And I think, we're always open even to those that have better knowledge around some of these areas to offer some of the solutions. And hence we've been working with multiple stakeholders in terms of just looking at how we strengthen this particular area.
Motalatale Modiba is the spokesperson for the Health Department in Gauteng. Thanks very much indeed for joining us. Absolutely bizarre story. A woman posing as a doctor at Thembisa Hospital has now been arrested, and it's not the first incident at Gauteng hospitals either. How do we get around this issue of bogus doctors? Interesting discussion indeed.